They say brain surgery belongs to the modern world, to the age of science, electricity, and machines. But centuries before hospitals, before scalpels or anesthesia, there were people who dared to open the human skull and heal it. No lights, no steel, no medical degrees, only stone blades, mountain herbs, and a faith deeper than fear. And the most shocking part? Their patients survived. This is not legend. It's carved proof in the bones of the Andes. In the late 1800s, explorers in Peru stumbled upon skulls unlike anything they'd ever seen. Perfectly cut holes, smooth edges, no sign of violence. And around those holes, evidence of healing. These weren't victims. They were survivors. As years passed, archaeologists found thousands more, buried in Inca and pre-Inca tombs. Some skulls had even been operated on multiple times. Each one told the same story, that ancient surgeons had learned how to open the skull, relieve pressure, and save lives. This was trepanation, brain surgery, performed over 1,000 years before modern medicine. The Inca healers had no iron, no electricity, but they had nature. Their scalpels were shards of obsidian, volcanic glass sharper than any metal. They sterilized wounds with burning herbs rich in antiseptic oils. They used chicha, fermented corn beer, to calm pain. And coca leaves, the same plant modern scientists turned into anesthetic, to numb the patient's senses and slow the heartbeat. Their operating rooms weren't hospitals. They were sacred spaces, lit by fire and incense, where medicine met spirituality. And healing was both science and prayer. A wounded warrior lies before the healer, his skull cracked in battle. There's no time, no machines, only skill. The healer steadies his breath and begins. Each motion is slow, exact, respectful. Stone scrapes bone. Blood trickles down. He removes the broken fragment to release pressure on the brain, then cleans the wound with honey and herbs, and seals it beneath layers of soft cotton and cloth. Days later, the warrior opens his eyes. He breathes. He speaks. He lives. When modern scientists examined these skulls under microscopes, they found the truth written in bone. Smooth edges where bone regrew, proof of recovery. Some skulls showed 2 or even 3 surgeries on the same person. The Inca success rate, nearly 70% survival. Compare that to 19th century Europe, where trained surgeons, with scalpels and hospitals, lost almost half their patients to infection. The Incas were not guessing. They understood anatomy, sanitation, and the healing power of herbs. They were doctors long before the world gave that title a name. Today's neurosurgeons use lasers, robots, and digital imaging. But their mission, to save a life, is no different. The Inca worked with instinct, guided by touch and courage. They mapped the human skull without books or machines. Through trial, memory, and a sacred respect for the body. Their world had no electricity, yet they discovered a light of their own. The light of understanding life itself. The Inca left no textbooks, no laboratories, no written guides. But their legacy survived, etched into bone, whispered by time. They proved that technology begins with compassion. That true knowledge can be born from pain. And that courage, the courage to open the mind to save another, is older than civilization itself. So when you see a modern surgeon's steady hands, Remember those ancient healers of the Andes, who showed us that sometimes the greatest operation is the one guided by the human heart. And next time, we journey even deeper into forgotten science. Episode 4: When the Ancient World Discovered Electricity. A time when sparks danced before wires existed, and light itself became a mystery waiting to be reborn.